Okay. Hi, my name is Kendra. I'll be performing your physical assessment. Can you tell me your name and date of birth?
Weston Workman, 11/02/1994.
Okay. And can you tell me where you are in today's date?
My house, and August 17th.
Okay. Client is alert and oriented times 4. Appears stated age. Facial expression is relaxed and at ease. Nutrition level is appropriate. Um, Hygiene is good and clean. And do you have any pain today?
No.
Okay, client has no pain. So I'm going to move on to inspect the head first, looking at the scalp, noting that the hair is clean and neat. All the features on the head are symmetrical. And now I'm going to look at the eyes, noting that they are in line. And the conjunctiva is pink and the sclera is white. And can you follow this from side to side? Okay, eyes move evenly, no nystagmus is noted. I don't have a pen light, so I'm just going to pretend and just look forward for me. Look forward. Pupils are equal, round, and reactive to light accommodation, and the light reflex is present. So I'm going to move on to the nose and note that the nares are patent. The mucous membranes are pink and moist, and there's no lesions noted. And going on to the ear, I'm noting that they are in line with the eyes. There's no lesions or exudate or any kind of drainage. On the mouth, so say ah. The mucous membranes are pink and moist. The uvulva is midline, and the tonsils are 2+. So I'm going to move on to the skin and note that the skin is warm, dry, and intact. There's no lesions. I'm going to test tinting. There's no tinting. It's less than 2 seconds. And I'm going to note that the cap refill is also prompt, less than 2 seconds. And there's no clubbing of the fingernails. Moving on to the neck, I'm going to note that there is no JVD at 35-degree angle, and I'll feel for the carotid pulses, and they are even bilaterally. And I'm going to listen to see if he has any carotid bruits. And no bruits were heard, no abnormal sounds. So I'll move on and inspect the chest, noting that it rises symmetrically. There's no heaves or lifts. I'm going to look at the point of maximum impulse, and it is at the 5th intercostal space. There's no enlargements, no abnormalities. I'm going to listen to the lung sounds, first on the front. Take a deep breath. Deep breath. Deep breath. And then 5 spots on the back. Breath. And then 1 more. Are you feeling dizzy? Okay, good. There were no abnormal sounds, so that was all clear. I'm going to listen to heart sounds. First, I'm going to just try to find S1 and S2. So, okay. S1 and S2 are noted, and they have good rate and rhythm, so I'm going to start with, I'm going to go over here and do the aortic. And pulmonic. Tricuspid. And mitral. And heart sounds have a good rate and rhythm, no abnormalities. So I'm going to move along to the abdomen. So if I can just have you lay down for a minute. So first I'm going to note the contour of the abdomen, that it's flat. And I'm going to listen to valve sounds, starting with the ileocecal valve. Okay, valve sounds are active and present in all 4 quadrants, so I'm going to listen if he has any aortic bruits. Okay, no aortic bruits were heard. So now I'm going to palpate your stomach, starting off light. So just tell me if you have any tenderness. No? Okay, I'm going to go deeper. Any tenderness? Hey, your phone only has 10%. Okay, so if you'll sit up for me, now I'm going to test your strength. So if you'll squeeze my fingers, okay, and push my hands, and pull my hands. And then if you'll do the same thing with your feet, push, okay. There's equal strength in all 4 extremities. And can you move your shoulders in a circle and your feet in a circle? Okay, full range of motion. And I'm going to check your pulses. And pulses are equal bilaterally. And I took vital signs prior to this and they were all normal. And I'm also going to note the skin and all the extremities and know that they are all appropriate color for his race. There's no lesions, no hearing deficits. And can I just have you walk across the room real quick? And gait and mobility are good and steady.